The reason why I'm making this video is I've had so many more people with chest pain. So I thought I would share with you the signs and symptoms that your chest pain is something simple, like you just need an adjustment to get that rib moving better, or if your chest pain is from something more insidious like a heart attack. And as always, before you follow any advice from any video, check with your healthcare provider to make sure it's accurate or appropriate for you. And hopefully that's one of us here at Chiropractic. And if you'd like our content, please let us know by clicking the like button. And if you have any questions or concerns or comments, you know we love to hear from you. Please post them below. So let's talk about symptoms you should not ignore. The number one thing you should never ignore is shortness of breath. Now, if you're short of breath because you ran for the first time in years or did a really physical activity that you're not used to doing, shortness of breath is going to be normal. But if you do an activity that you've done before that wasn't a problem, like going up a flight of steps or walking up a ramp, and you're noticing, wow, I'm having trouble breathing, that is a serious concern. If you have to sit down and catch your breath after doing something normal, you need to seek immediate medical attention. It could be your heart, it could be a lung disease, it could be all kinds of things. You have to get that checked out. I had a patient who was on vacation and she shot me an email and she said, I think my rib is out. I can't seem to pop it back in place. I can't get a comfortable position. I'm having trouble breathing. My rib is out so bad. And I was a little concerned because she said the words, I can't find a comfortable position. Usually if a rib is out or if the cause of chest pain is musculoskeletal, you can find a position of relief to get pressure off the muscle or the joint that's involved. So the fact that she was literally writhing in pain caused me concern. And I emailed her promptly saying, you need to get medical attention. So what we found out was while she was on the plane, she developed a deep vein thrombosis that caused an embolism into her lungs, and that was causing her chest pain. So we were really grateful she sought immediate medical attention because that can be fatal. Another thing you shouldn't ignore is chest pain with excessive coughing. Now, if your chest pain is because you cough so hard you strain the muscles of your rib cage, that's one thing. But maybe you're coughing because of a lung condition that needs to be addressed. If you have chest pain with nausea, that's another concern. Now, you can have nausea because your chest is in pain, but if your nausea is due to a disease process that's causing your chest pain, that needs to be explored. If you have chest pain with lightheadedness, unusual fatigue, GERD or heartburn or excessive sweating, these are serious symptoms that you should never ignore. Get it assessed. I would rather you see a chiropractor instead of no healthcare professional at all. I mean, we go to school for 4 years, not to learn to just adjust, but to learn how to differential diagnose so we know when not to adjust. And we'll refer you out to the specialist that you need to see. I've had patients come in with chest pain, and after examining them, I don't find any ribs are out, there's no tight muscles, I can't find a cause for their chest pain. So upon further examination, I had this one guy, he goes, well, I also have some poison ivy. So I checked it out, and it wasn't poison ivy, it was shingles, and that was what was causing his chest pain. In fact, I had one patient come in, and after hearing her history, I didn't even examine her. I was like, you need to get out. And she's like, why? Do I smell? And I was like, no, you have to get to the emergency room because I'm really concerned for you. I was concerned about a heart attack or some serious condition because it obviously wasn't a rib that was out like she was expecting it to be. I'll share another story on the flip side. I had a patient who had chest pain for over a year by the time I met her. She had spent tens of thousands of dollars on exams like MRIs, CTs, ultrasounds, lab work, and one of the labs came back where her gallbladder might be a little off. So they literally surgically removed her gallbladder and she still didn't find any relief. One visit with me, her rib was out. One adjustment, felt great. So if you have chest pain and it's not an emergency, go see a chiropractor. I always say, like, if your heart is fine and they can't find anything immediate, while you're waiting for more exams and imaging and laboratory work, see your chiropractor while you're waiting for all that. And if we find out it's just a rib, that saves you tens of thousands of dollars. So why not see a chiropractor? I mean, I'm kind of biased, but getting an adjustment just plain feels good and might fix you.
Awesome.
And here at Drummond Chiropractic, all of our chiropractors pride themselves in being our patients' friends in the healthcare business. So even if it's not a chiropractic condition, we can help them navigate through their medical decision making. I hope this helps you understand the different kinds of chest pain, and I hope it encourages you never to ignore chest pain. Until next time, stay well.